Welcome to CSI TV Cochin 2016. Today we have Dr. Vidyut Jain from Indore, one of the eminent cardiologists. Sir was the past National Vice President of Cardiological Society of India, and he is also the National Convener of Hypertension Council of CSI currently. Welcome, sir, on the show.
Thank you.
Sir, today we are going to discuss about your topic on the sprint trial. So, may I ask, sir, what was the need for conducting such a clinical trial with such a huge population?
You know that hypertension is very much prevalent among the adult population. Up to 20 to 30% of patients at the age of 60 years, they are suffering from hypertension, which has got morbidity as well as the increased mortality in the terms of cardiovascular events, increased cerebrovascular event, peripheral artery disease, and cardiac failure in future. So people were trying to look at what should be our target of blood pressure control, thereby prevent this end organ damage or mortality reduction. So they thought that we have been monitoring this blood pressure according to JNC guideline 8, keeping BP around 140 systolic. But from various previous trial, it has been understood the mortality data were not coming down. So it was thought, okay, why not to reduce blood pressure further? So it was done in a very systematic manner. They included the patient who were beyond the age of 50, more so 75 years, although they did not include diabetic patient. And they included those patients who were already taking antihypertensive with some additional risk factor. And they divided two groups. One group was aimed to keep the blood pressure around 120 millimeter systolic. Another was to keep around 135, 134 millimeter of systolic blood pressure. At the end of 3.5 years, they found out that cardiovascular event and cardiovascular mortality and all-cause mortality was much less when the blood pressure was targeted to 120 systolic. It was more definitely in the patient who were on standard therapy. So it is called aggressive therapy as well intensive standard therapy. So if we go by the data of sprint trial, it has been learned that from the 8,000 patient trial, this particular level of blood pressure, if it is kept around 120 systolic, long-term and short-term benefits are more. So this was concluded out of this sprint trial.